So a 76-year-old male client had a thromboembolic right stroke. His left arm is swollen. Which of the following conditions may cause swelling after a stroke? So what are your key words here? You're looking at what? Their age, is there a medical condition, and signs and symptoms. As always, I recommend that you have something to write with, something to write on, because is this condition, stroke, something that you're familiar with, or do you need to study in your content study time? You want to use something to write your answer as well as to write your rationale, or is your thinking in alignment with the questions or the right answers rationale? All right, so is it A, elbow contracture secondary to spasticity, B, loss of muscle contraction decreasing venous return, C, deep vein thrombosis due to immobility of the ipsilateral side, or D, hypoalbuminemia due to protein escaping from an inflamed glomerulus? All right. So often we want to read into questions, right? We want to give somebody a condition, but we need to make note of, and go ahead and pause. Pause and jot down your answer and then come back, and we're back. So we need to make note of what's actually going on. Thromboembolic right stroke, arm swelling. Okay, so more than likely if he's having that, he's not going to want to move his arm, right? So what conditions may cause swelling after stroke? We have some pieces of the puzzle in the scenario: age, condition, and symptoms. Elbow contracture secondary to spasticity doesn't say anything about spasticity or having problems with that, or even anything about his elbow. B, loss of muscle contraction decreases venous return. That is true. That is the answer I went automatically to when somebody's had a stroke, maybe because of my years of taking care of someone. But when we have decreased mobility or movement, you have also tend to have decreased blood flow to the area, right? And then if you have decreased blood flow, blood is not moving like it should and therefore causes swelling. Deep vein thrombosis due to immobility of the ipsilateral side, not necessarily, typically not, they're less likely to have that, more likely to have deep vein thrombosis in their legs. As you know, deep vein thrombosis usually occur in their legs. Protein issues is not an issue when we're talking about somebody with a stroke. So the answer is B. Again, this is a nurse's lab question. I love it because it gives you the rationale of the right answer as well as the wrong answer. DVT may develop with stroke, but it's less likely to occur. It's more likely to occur in the lower extremities. DVT and contractions may happen, but they don't usually cause the swelling. And D, protein loss is not associated with stroke. So I hope this question has helped you, and I wish you much success. Take your time and really